Hello, I am Vidhya Venugopal, a professor in the Department of Environmental Health Engineering, Faculty of Public Health at Sri Ramchandra Institute of Higher Education and Research. I work in the area of environmental and occupational health, and I'm also a trained industrial hygienist, and my passion is to work on women workers and their health and safety. Migrant women workers are very much impacted by climate change, and investigating the health and safety and sanitation issues faced by these vulnerable women is very important. Identifying the impacts of inadequate welfare facilities, developing actionable interventions that could actually improve their workplace life, and safe workplace which can empower these women, protect dignity, and drive gender equity. Why you are very passionate about it? Because we want to identify sustainable intervention for healthier, safer, and happier workplaces. We want to advocate for she-inclusive policies to enhance work safety, and dignity for these women, bridge the research gaps on migrant women workplace vulnerabilities, and why we are passionate, commitment to gender equity and social justice, most needed at this time of during this time, ensuring dignity and well-being for these marginalized women workers, addressing overlooked challenges of sanitation and occupational hazards, which is the most essential thing in any workplace. Women and men experience climate change differently. Globally, women make up a significant number of workers in the informal sectors, which often encompasses precarious and vulnerable work conditions, such as low wages, lack of cooling, water services, and basic toilet facilities too. Women face discrimination, harassment, lack of access to menstrual health and childcare facilities at any workplace. Addressing these challenges requires she-inclusive frameworks, focusing on sanitation access, fair wages, gender responsive labor laws, and sustainable interventions. So what we found when we worked with this 437 women the women are at a risk of higher urogenital issues, which is like almost 2 times, 1.8 times higher risk of productivity drops, and 2 times the higher risk of interpersonal issues with their managers and supervisors. And 80% of these migrant women were reported self-heat related issues. And the graph clearly tells like how these women are impacted. There are solutions available. If the workplace policies ensure fair wages, safety standards, and welfare programs, these women migrant workers might be very benefited. And support networks like NGO collaborations, helplines, grievance redressal mechanisms could also help. Workplace infrastructure upgrades, like providing the basic sanitation and toilet facilities, is very, very important. Training and awareness programs, making them aware about what is available, and then changes in policy, employer resistance. There are various challenges we usually see in these, but all of this can become opportunities for us. The corporate social responsibility could be one of the things. Private companies can fund and implement sanitation facilities in these workplaces. Multi-stakeholder collaboration can happen with the NGOs and the grassroots level people. International commitment and funding can also help these migrant women. The policy and advocacy thing is like there is nothing called no one size fits all approach. Different industries, different labor structures require tailored policies. Large corporations could include she in their CSR frameworks. Small enterprises could actually sensitize these women workers about the government subsidies, incentives for improved workplace safety, wage protection schemes, etc. Informal sectors and home-based workers can include social security scheme establishment of grievance mechanisms. What we learned from the journey is grounded the project in lived experiences of these migrant women, ensuring their voices shape every intervention. And we wanted to foster collaborations by engaging diverse stakeholders, including employers, policymakers, and the community as well. And we designed a multi-pronged approach, addressing immediate health challenges while advocating for systemic change. And we wanted to deliver very impactful, tangible outcomes, working to improve workplace policies, increase healthcare access, and empower peer networks. When it comes to connecting the dots, addressing gender equities in health access and empowering women, strategic integration of stakeholder engagement and advocacy, and sustaining the momentum, it's very important that what we have started should continue. And we wanted to focus on integrating gender-sensitive policy at state and national levels, which can happen at a later date. Invest in digital tools and healthcare initiative to scale the project across the state and the country.
பாத்ரூம் கட்டி இப்போ லேடிஸ் ஜென்ஸு கூட எங்கன்னா போயிடுவாங்க. லேடிஸு எதுக்குன்னா போகிறதுனா ரொம்ப கஷ்டமாக இருக்கும். ரொம்ப தொலைவிட்டாக தான் போகணும். அதனால அந்த பாத்ரூமும் எல்லாம் யூஸ் பண்ணதால யூஸ் பண்ண முடியல.
ಇಲ್ಲಿ ಕತ್ತನರವೆಲ್ಲ ತಳವಿಲ್ಲ ಅದು ಬಾತ್ರೂಮ್ ಸುತ್ತಮ ಇಲ್ಲ இங்கே ஹாஸ்பிட்டல் இல்லை எதுவுமே ஒன்றும் பச்சண்டே இல்லை ரொம்ப தூரம் ஒரு 3 கிலோமீட்டர் போகணும்.
Thank you very much for your time.